Would you be willing to break your legs if it meant you could be taller? For some, the answer is yes. Check it out. Being short is a common frustration for many, but for a long time there weren't many realistic solutions. Limb lengthening procedures have been around for years, but were extremely invasive and mainly reserved for those with disabilities or even uneven limbs. But now, doctors are offering elective lengthening procedures so that patients add a few inches to their height. Are these procedures the future of cosmetic surgery, or are they too good to be true? Here with us today is orthopedic surgeon and founder of the Limb Plastics Institute, Dr. Kevin Debiparshad, along with his patient, David. Thank you both for being here.
Thank you for having us.
Thank you.
As a patient who's had this procedure, what motivated you to do it?
It's definitely a confidence booster for me. I mean, I definitely wanted to get taller. I started off around a little over 5'7". I was able to get to 5'9", which is the industry standard for males in the U.S.
So almost 2 inches.
And having gone through it, no regrets.
I don't have any regrets. I probably regretted it a gazillion times going through it. It's definitely, you know, it is a painful procedure.
Can you walk us through what that process is like and the pain and rehabilitation? Because again, part of it is cost, part of it is safety, and then part of it's the recovery.
Yeah, so I mean, within the second day, I'm out of the hospital bed and I'm doing laps around the hospital with my walker. On the third day, I'm released. I start physical therapy, and within about 2 or 3 weeks, I'm off the walker and I'm walking. After about 2 months of doing that, then you go into a phase of healing. So it takes a long time for the bone to actually harden. So you do a lot of visits back to the office, do a lot of x-rays, checking that out. And then once it's solidified in the legs, you go back in for a procedure where he'll remove it. That's an outpatient procedure. It's hardly any pain at all. Within a couple of weeks, I was back to normal.
Can you explain exactly how this procedure works?
Sure. So from a simplistic standpoint, essentially we're just going in either to the thigh bone, which is the femur, or the lower leg bone, the tibia, and we're essentially separating that bone by cutting it, placing this implant in position that responds to a remote control that slowly lengthens the tissue, and then patients can become 3 to 6 inches taller, just depending on if they get 1 or 2 procedures. Pretty minimally invasive. It's guided by x-ray, so we do the entire surgery via x-ray. So it's 4 to 6 very small incisions that we either place around the thigh or the lower leg. What we end up doing, and I'll just use this model here, we try to make a little window into the bone itself, so we gain access to the tunnel of the bone. Then what we do is we actually place the device actually into the actual tunnel. Okay. Prior to that, we are separating the bone through a small incision. We then lock it or transfix it with the screws at the top and the bottom of the actual implant. Then that nail actually responds to an external remote control that the patients get, and they can lengthen approximately about 1 millimeter a day. So it takes about 25 days or so to get an inch. Generally, patients are up walking the same day of surgery with the therapist, or they'll start walking the next day. It takes a couple of weeks to return back to your general activities, and probably a couple of months before you sort of realize your final length.
And then if someone successfully goes through this, are their bones strong? Like, how does this impact their ability to, say, participate in sports and their usual gait?
The more length that you try to achieve, it can impact or depreciate some of your high-level functioning, like your athletic ability. So what I generally tell patients is that you're getting the height or you're trading it for something. It's not free, and that is potentially some depreciation in that athletic ability.
Long term, is there any data, because this is so new, in terms of, okay, does this increase load on a hip joint, which then may increase load on the spine for your patients?
Sure, and we have some data. We've looked at, for instance, the geometry around joints and looking to see if there's any changes in that. We actually don't see much changing around the joints themselves, around the hip, the knee. So we do have a lot of information and data and see that there doesn't look to be any sort of long-term complications, and we have data from that, from children, from trauma patients, so that data does exist. Now, though, with newer technology and neurosurgical ability, we're allowing patients to look at this as an elective procedure to actually be taller.
How much would a case like this cost?
Right, so this wouldn't be covered by insurance from the cosmetic perspective. The general price starts at about $76,000, and half of that cost is really the implant, because the implants are extremely expensive.